Hi folks, welcome again to another episode of the Reba Ayaz show. On our show today, we have a cardiologist with us. His name is Dr.Abhijeet Aklujkar.
Cordis Heart Institute to kindly come up on the stage for the felicitation of iconic international cardiologist for EECP treatment.
Sir, welcome to the show.
Hello.
I have a set of questions, Once I go into the social media, I find all sorts of therapies, homemade therapies in terms of cardio issues and all that stuff. First of all, sir, I would like to ask you that why are the people between the age group of 30 to 40 have suddenly developed cardiac issues?
See, very unfortunately actually, today India is become a diabetic capital in the world. As Asian Indians, our size of the coronary arteries is very small as compared to the Western population.
Okay.
Because the Western population, the height is more and the build is large, so that the coronary artery size is also more. So in India, what is happening is because the coronary artery size is small, the chances that you get coronary artery disease, that is heart disease, is at an early age as compared to Western population. So what in India now is happening is we are following Western lifestyle. Our traditional lifestyle, what we were used to be, we are going away from that and we are getting more and more westernized.
Okay.
So because of that, what is happening is the activity level has gone down substantially and the stress level has gone up substantially. India, earlier there always used to be a traditional family system.
Okay.
We are becoming more and more nuclear.
Okay.
With more and more expectations. So the population as a whole, the expectation from the life has increased. So that brings a lot of stress in your body. So now financial stress, then there is a family stress, there is a relationship stress. So more and more you become westernized, the stress is going to go up. So and this is what is affecting the youth. Again, if you see so many today in the entertainment industry, if you see the smoking, they are showing smoking so very commonly. I mean, you go any movie, the actor, actress, is very commonly they are smoking.
Without smoke, there is no shot which is complete.
That is not complete, and it's showed as it's cool. It's cool. So this is very subtly they are pushing cigarettes inside the brains of our population. So youngsters, they are getting affected with a lot of smoking. So then there is a stress which is going on. The activity level is going down. So all these factors, if you look at, other than that also you see tobacco. So tobacco chewing, hookahs, these hookah parlors, there are so many things that has now entered into our young population, and this is destroying our young population.
In last 10 years of time, I have seen that the kind of fitness mantra is very much amongst the people now. I see the young generation going to the gym. I see the young generation started walking. So that awareness is definitely there. But in spite of that, on a treadmill, I also do feel people collapsing.
See again,
what kind of, in spite of being fitness freaks, so-called, why do they collapse on the...
See, recently there are so many heart attacks that has happened to, like, if you know the KK, the singer.
The singer, yes.
The singer.
Yes.
Look at his physique. You can go to YouTube and
yes.
Google it in the KK and you see his physique. I mean, he's having six-pack abs and he just had a cardiac arrest and died.
Right.
So how is that paradox? There is a paradox here, right? I am fit. So I did an angiography of Mr. Mumbai when I was in Jaslok. We did an angiography of Mr. Mumbai and he was Mr. Mumbai. I mean, awarded Mr. Mumbai. And we did his angiography and all three arteries were blocked. He started crying on table. Mr. Mumbai started crying on table. I am a person who has muscles and my arteries are weak. So there is a total, the understanding of fitness has gone by. So the fitness is not having muscles.
Okay.
First of all.
Okay.
Fitness is not about muscles. Fitness is about your endurance. Second is your lifestyle. So I go to the gym for 3 hours and then at night I will sleep at 3 o'clock. I will smoke. I'll have drinks and do a party. And then I will sleep at 3 o'clock at night. And then I expect that 3 hours of gym will compensate to whatever wrong things I am doing throughout my day. This is not going to happen, my brothers.
Okay.
This is not going to happen.
Okay.
So if you want to be fit, your lifestyle has to be in place. Now you see today all kind of the Bollywood actors, so many of them, they have understood the value. They have understood the value of lifestyle. They are now not going for nightclubs.
Yeah.
There are so many of them.
Yeah.
There are so many of them. Akshay Kumar is one of them. The most important thing is sleep is again becoming deficient. So few things we talked earlier, now we are talking about sleep. So the generation you are looking at is like they are now on OTT, they are on the mobiles, they are on their iPads. So they are sleeping late. When they come home from the office, have a dinner at late, so there is a late dinner that's going on, so that's again wrong lifestyle. Then they're sleeping late, so sleeping late is like 2 o'clock, 3 o'clock. All these IT professionals, so many patients I get who are IT professionals, they have to match time with US and UK. So they are sleeping late because compulsion of taking calls and being on logged on.
A night here is a day out there.
So many problems because of this Western lifestyle. Again, we are coming to the same thing where people are becoming more and more money oriented. We want more expectations. We want more out of life. The stress increases.
We all have entered into the age of anxiety and restlessness. Everybody is restless. Everybody is anxious. That's what he has narrated right now. There's one question which I would like to ask him, and there's a lot of narrative which is going on around this question. Is the COVID shield drug or injection responsible for the early heart attacks?
Yeah, see, this is a very good question actually. So this Covishield vaccine which was there, it had a protein called as spike protein. So this spike protein, this is a pro-coagulant kind of a protein where when it goes inside your body, it can lead to increase blood clots in your body. So when this COVID vaccine was there, we saw a spurt of heart problems.
Yes.
But again, you have to understand that's not permanent. That's not permanent. The vaccine, once the spike protein, the immunity and the spike protein level goes out of your body after maybe 1 year or 2 years, we don't know the time period. But once it's out, it's now you can't attribute to it. It was 2022.
But it does have a role to play.
100%. 100%. It definitely, the spike protein, it's known entity where it caused spike in the heart problems where people, and I'll tell you what, people already have blockages. We don't know that they are having blockages. When the clot goes and sits on that blockages, you get a heart attack.
Okay.
So that's the thing.
Okay.
So normal people who didn't have blockages, even with this pro-coagulant protein going inside the body, it didn't cause problems. So someone might argue why it's not causing problem to the whole population. So it will not cause problem to the whole population because everybody is not roaming around with the blocks. So you have to understand that blocks are there. Maybe in so many people we don't know that they are having asymptomatic blocks inside the body, inside the coronary arteries. But then the event happens only when there is a clot which goes and sits on that block, and then there is a coronary event, there is a cardiac event that happens.
Dr. Abhijeet, you see, doctors basically, I have an issue with doctors. They don't laugh. I mean, when patients come to you, you're so serious, they don't laugh. But I can see the smile on his face, which has an ability to launch 1,000 ships. There's one thing which I would like to ask Dr. Abhijeet. In terms of technological advancement, in terms of cardiology, how do you think the future of heart problems can be tackled?
See, again, you have to attack the root of the problem. In cardiac problems, if you look at majority of the cardiology fraternity per se, the main root cause of the problem is the lifestyle. Heart problems are totally preventable, 100% preventable. But if you don't change the lifestyle of the person and only keep on treating the superficial effects of that lifestyle problems which are happening.
It's also said that it's hereditary. Your father had a problem, you'll have a problem.
So see, hereditary.
Can it be curtailed to a certain extent through your lifestyle?
I'll explain you what is hereditary. Suppose you have a gun. You put a bullet inside that gun. So the bullet inside that gun is your hereditary problem. right? So suppose your father has a heart problem. So there are chances that you will get it. So it's like a bullet inside the gun. So till the time you pull the trigger, that bullet is not going to come out. So now what you want to do, you don't have to pull that trigger.
Okay.
So lifestyle is the trigger.
Okay.
So even if the person has hereditary problem, but he has a good lifestyle, the trigger will never be pulled and he will not be affected.
What a beautiful way of making us all understand. Dr. Abhijeet, besides being a doctor, I do find a lot of empathy with him. He's basically, he was working with big corporate hospitals in Mumbai, doing good for his life. But with the advent of time, he realized that through the processes of angiography and stent, a common man cannot afford the huge expenses which is incurred in the corporate sector. I'm talking about the hospitals. Now, taking this need into consideration, he left his job, a fat job, and he started up his own setup whereby he treats people on, I think, less than half the cost of what you see in corporates?
Yeah. We do a therapy called as enhanced external counterpulsation, that's EECP. This is a very non-invasive thing, nothing goes inside your body, and it's a US FDA approved treatment, and it's been there in India since last 20 years, but nobody talks about it, and nobody really uses it. So if you go to a cardiologist, you'll just brush it away. So that's the problem in India, because there are so many patients who can't afford, who are not fit for cardiac surgeries, whose heart pumping is so low that the risk for surgery is very high. Even after angioplasty and bypass, it's failed. Now the second procedure is not feasible, not affordable. So there are so many patients who are left out on their fate. So all these kind of patients, by EECP, really they do magical things for them. And the cost of the therapy is almost 1/3 to what we are expecting in angiography, angioplasty and bypass.
I think one of the greatest challenges in terms of cardiology is if you have a heart attack, you have a thing known as STEM, you have a bypass surgery. What do you do in a situation where the ejection fraction, the EC of the heart, the EF of the heart, if I'm correct, is weak? Can you revive that heart muscle?
Yeah.
Can that be revived?
See, once the heart pumping is down, it can happen because of two things. It's like a tree. If the tree does not get a water supply, it will dry up. Similarly, the heart muscle is like a tree where if you don't get oxygen supply, the muscle is going to die. So one of the causes for that is where the blood supply to the heart is not happening properly. We call it as ischemic cardiomyopathy, where the blood supply is not happening, therefore the heart pumping has gone down. Second thing is where the muscle has been damaged by most commonly viral attack. So there are so many viruses who are moving around which can cause illness, fever in your body and can directly attack your heart muscle. And where the heart muscle gets damaged, we don't come to know also. And once the 2D echo is done or you got getting heart symptoms, that is the time we come to know that the heart pumping has gone down. So these are the two main things. There are other problems of the heart muscles also, like because of thyroid problem, the heart muscle becomes weak. So these are correctable problems. Like suppose there is a blood supply problem which is there. So we do EECP or you do bypass or do angioplasty, the heart pumping can improve.
Right.
But if there is a viral attack which has happened and the muscle has become damaged because of the viral attack, then there is nothing much, because it's irreversible damaged muscle and the cause etiology cannot be reversed. So the muscle once gets damaged, it cannot be reversed. But in cases of ischemia where the blood supply has reduced, we can increase the blood supply by various means and then the heart pumping can come up. That's how it is.
So there are three things which has been very confusing, not only for me but some of our viewers. What is the difference between a cardiac arrest, myocardial infarction, and ischemic, what you said right now?
Cardiomyopathy.
What is the three differences?
See, cardiac arrest, you have to understand. Arrest means what?
Heart stops.
When the police comes and arrests you, so it's you taken away.
Okay.
So arrest is where the heart stops. So cardiac arrest, cardiac is heart. So when the heart stops, it's called as cardiac arrest. So because it's the manifestation of the problem. So myocardial infarction is the heart muscle getting damaged because of clot in the coronary artery.
Okay.
So that's called as myocardial infarction, the heart getting damaged.
Okay.
That is infarction.
Okay.
So myocardium is again heart. So the heart getting damaged, and the manifestation of that myocardial damage can be cardiac arrest.
Okay.
So young person gets a myocardial infarction and he can get a cardiac arrest,
Okay.
and the heart stops.
Right.
So for that we do CPR. So coming to this very important thing. So 1 in 3 survivors with CPR, we can save somebody's life. So everybody in India should know CPR actually. So many people don't know CPR. Majority of the people don't know CPR. So CPR should be learned. It's very easy procedure. Yeah.
What nutrition should one take for a good heart? That's number 1. Number 2, is walking a good exercise for heart, or going to the gym and exercising your muscles?
See, first question of yours was nutrition. So as far as nutrition is concerned, because of the stress, what happens in your body? There is oxygen radicals that gets released. So oxygen radicals are going to go and damage your coronary arteries, the arteries in your body, everywhere. So we require antioxidants. So more and more antioxidants are there, your heart will be better. So what antioxidants you can get from nature? You can ask this question very easy. You can get so many fruits. These fruits are a very good source of antioxidants.
Okay.
You can have nuts, you can have seeds. These are all full of antioxidants. Berries, full of antioxidants.
Right.
So your diet has to encompass this.
Yeah. It has to be a judicious mix of...
Yeah, fruits, nuts, seeds, berries. These are full of antioxidants. So on the daily basis, you should take this. Now, a very easy berry which is available. Nobody talks about it. Which is very cheap also in India. You know that? It is called as avla.
Avla. Oh, yes.
Nobody looks at it.
Yeah.
Available where? Every bhajiwala will have avla.
Yeah,
How many
right.
of you? How many of you have eaten avla today? So you should start taking avla shots. Take avla every day. That is best antioxidant that you can have every day. Avla, according to Ayurveda, is 3 doshik. It reduces all 3 doshas. Ayurveda, I study Ayurveda also. So Ayurveda, it will reduce all your body toxins. It will come down. Your oxidants will come down. So oxygen radicals will come down if you take avla. So best thing is that you should start taking avla from tomorrow.
You heard it from the horse's mouth, okay? Avla consumption daily. So is there any time? There are some people who say that after sunrise, you can eat fruit. After sunset, you cannot eat fruit. What is the time should I eat avla? Should it be empty stomach after breakfast? There's a lot of confusion.
See, the thing is, in India, there was a study which was done. It is called as India Today Saffola Life Study. So in that they found that only 20% of Indians eat fruits. Forget when to eat.
Oh God.
Only 20% of Indians. They studied all 4 metros. They studied Mumbai, Delhi, Madras and Calcutta and Ahmedabad also. And there they found out that only 20% of Indians they eat fruits. Only 30% of people do exercises. They just don't move. So forget when to eat. Start eating. So first of all, start eating.
Yeah.
So
Sir has exposed the statistics which we Indians have in terms of food. So what he says, forget about everything, just start eating no matter what time it is all about. Right, sir, it was a pleasure talking to you. Thanks a lot.
thank you.
That was Dr. Abhijeet. Keep watching.